We are in Carolina Medical Center in Warsaw today. We are talking about a hip resurfacing method. Our guest is Dr. Laskowski, head of hip treatment department, hip pain treatment department in this medical unit. Hello.
Hello.
To start with, I'd like to ask you about your personal experience, your personal practice with the hip resurfacing method. Could you please tell us how long have you been conducting such operations like these, and how many hip resurfacings have you done so far?
I started in 2003 in March, and by now I've done more than 500.
And how many?
Hip resurfacing, Birmingham hip resurfacing. This is the implant we use since the beginning.
And how many second operations, how many revisions were required?
6 revisions in this period, so which gives us a pretty good result, about 1% of revision rate.
When were they required? How long after the first operations revisions usually take place?
Most of the complications are in the first 6 months after the operation. Yeah? So in each surgery, each implant surgery. So we distinguish early complications and late complications. Early are in this first months after the surgery, and late are years after.
Could you please tell us who did you train with, if you remember, your teacher, when and where?
I remember.
Sure.
It was Professor Michael Fensen from Berlin.
All right.
First, I was invited to the Congress of German Orthopedic Society in Dresden. It was a session about the Birmingham hip resurfacing, and Dr. Derek McMinn was a guest. So I met him there, and then Professor Fensen from Berlin came to Carolina Medical Center. He performed first 5 operations, and then I started myself.
So after many years of your practice, if we talk about the procedure itself, could you please tell us what hip device do you use? What kind of approach, surgical approach, do you prefer to use?
As I told you, since the beginning, we use Birmingham hip resurfacing. We started with Birmingham hip resurfacing, and it was a good choice, yes, because this is the best implant, and still with the very good results. Later on some other implants from other companies, but still we kept on the BHR. Yeah. Because we always thought that it's the best, yes, the best quality, and the disadvantage was that it was most expensive implant. But in our private hospital, the price is not so important as the quality for our patients. So that's why we have a luxury of using the best implants.